the deposition of lipids and formation of atheroma in the blood vessel, in the carotid blood vessels on both sides of the neck can encourage the formation of clots and narrowing of the blood vessel of the carotid blood vessel. And this will lead to the interruption of blood flow to the brain as well. So this is again an important risk factor regarding stroke that we are very much aware. I would like to talk about another an important risk factor regarding stroke, and that is atrial fibrillation or irregular heartbeats. Irregular heartbeats could happen due to ischemic heart disease or problems of the blood vessels of the coronaries of the heart, and that again is a disease for elderly. Sometimes there is a correlation, positive correlation, between obesity and actually irregularities of the heartbeats or the palpitations. These palpitations can be felt by the patient sometimes, but clinically we need to do ECG, and that is electrocardiogram, to rule out the atrial fibrillation or irregularities of the heartbeats. But the ruling out by ECG itself is not in 100% of patients. It can only be ruled out in about 10% of patients if we do the ECG. The other method of investigation is to do Holter monitor or 24 hours monitor or 48 hours monitor or 72 hours monitoring the heartbeats in the hospital. And that can be very useful to rule out palpitations or to rule out atrial fibrillation, irregular heartbeats regarding the risk factors for stroke. If we can rule this out, it means that the patient could only receive aspirin as for the prevention, as for secondary prevention of their stroke. Otherwise, if the doctor can prove that patient had atrial fibrillation, the treatment is different because the patient then might need anticoagulation with warfarin or other new medications now in the market instead of the warfarin.